We're all here, so let's go ahead and call this meeting to order. If you're able, please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Good evening. Roll call, please.
Director Yee,
Present.
Director Stewart,
Present.
Director Wallace,
Present.
Director Epen,
Present.
Director Nicholson.
Present.
Very good. And who else is there with you? Please.
We have Kimberly Hartz, Chris Henry, Tina Nunez, Larry Labossiere, Nicholas Kazachenko, Shri Badu, and me, D'Antonio.
Okay, very good. Thank you. Welcome to the October 26, 2022 regular meeting of the Washington Township Healthcare District Board of Directors. To continue to protect the health and safety of the members of the board, district staff, and members of the public from the dangers posed by the SARS-CoV-2 virus, the Brown Act allows a local agency to continue to hold its meetings remotely as opposed to being required to meet in person. Section 54953E3 of the Government Code requires that the board make certain findings every 30 days to continue meeting remotely. One such finding is that, quote, state or local officials continue to impose or recommend measures to promote social distancing, end quote. The Alameda County Health Officer continues to recommend social distancing and the wearing of masks indoors. I refer the public to the Alameda County Healthcare Services Public Health Department COVID-19 website at www.covid-19.acgov.org. The board made such a finding at its meeting earlier this month. Public notice for this meeting, including dial-in information, has been posted appropriately on our website. Tonight's meeting will be conducted by Zoom. I ask that you please mute your system until such time as you need to speak. We are recording tonight's regular session of the board meeting. It will be posted on our website for future viewing. Moving on to communications. Members of the public are invited to speak during oral communications. When prompted, please state your name for the record, then proceed with your statement not to exceed 3 minutes on issues or concerns not on the agenda and within the subject matter of jurisdiction of the board. Are there any members of the public who would like to speak at this meeting? Are there any written communications, Dee?
No, there are not.
Okay, very good. Thank you. Then we'll move on to our consent calendar. The consent calendar consists of those agenda items that the board will approve with one motion, unless either a member of the board or a member of the public requests to remove an agenda item from the consent calendar. Any items, if any items are removed from the consent calendar, the board will take action on the removed agenda item later in the meeting under the action item heading of the agenda. Does anyone on the board want to remove an agenda item from the consent calendar? No. Does any member of the public want to remove an agenda item from the consent calendar? Hearing none, then may I have a motion to approve the consent calendar items A and B, please?
Madam President, I move approval of items A and B of the consent calendar.
Thank you, Director Wallace. Is there a second?
Second.
Thank you, Dr. Epen. Roll call, please.
Director Yee,
Aye.
Director Stewart,
Aye.
Director Wallace,
Aye.
Director Epen,
Aye.
Director Nicholson.
Aye.
Very good. Thank you. Okay, we're going to move on to our action item, and I'll let Kimberly go ahead and address this, please.
Thank you, Madam President. This evening, we're asking the board to consider resolution number 1246 to authorize the Chief Executive Officer to enter into several agreements with UCSF for a joint cancer center. And I want to just say, and I'm going to be turning it over to Donald Pipkin, our Chief of Strategic Management, but this is a really important strategic initiative for the healthcare system. This joint venture with UCSF will allow us to have a fully integrated approach to bringing academic level oncology services to our community. And I'm very excited to be able to help to bring this level. This has been something that we've been working on for many months with UCSF Health, and feel like this is an important initiative to be bringing forward to our community, and it will truly make a difference in oncology care that we can provide now and into the future. So Donald Pipkin's going to talk more specifically about the agreements that are needed to be approved by the Board of Directors and the vision that we will be creating with this joint venture.
Great, thanks, Kimberly. So I will just launch a presentation here. All right, good evening, Board of Directors and those in the boardroom. Tonight, as Kimberly mentioned, I'll be giving a brief overview of history of cancer care at Washington Hospital, the overall affiliation with UCSF, and that history of cancer care relationship we currently have, as well as looking at the proposed joint venture and some of the benefits to patients and district residents through that, and then what the process and timeline looks like. So as you know, Washington Hospital has a long history of providing high quality cancer care services to the residents of our district. We've been accredited by the American College of Surgeons, Commission on Cancer since 1993, and just recently this year successfully were reaccredited. Since 2012, we've been designated as a breast imaging center of excellence by the American College of Radiology. We have a comprehensive breast navigator program for patients as they access services throughout the system. And we really have an interdisciplinary team of physicians and specially trained and certified oncology nurses, as well as other clinical experts throughout the system. As I mentioned, we have site-specific programs. The breast cancer care program is a good example, as is the lung screening program. We have state-of-the-art facilities in the Women's Center and the Outpatient Imaging Center, as well as the San Diego RN Infusion Center and our Radiation Oncology Center located near the 2500 Mallory Building. In addition, we have interventional radiology physicians that offer a number of options for the least invasive treatments available. And we have a growing clinical research program currently, and certainly will with the proposed joint venture into the future. And cancer, as is true with many communities, was identified as a community health concern in our most recent community health needs assessment for the hospital. As you know, Washington Hospital and UCSF Health have been in affiliation for just over 9 years now. And really it's about moving physicians and not patients, making sure that we have as efficient access as possible for patients in the district to those services that can be provided here locally, decreasing hardships when they do need to access those higher acuity services, and collaborating with an academic medical center to really provide those specialty or subspecialty services locally through program development, all the while sharing best practices throughout the continuum of care. Initially, the program and the affiliation was focused on the maternal child health program, including pediatrics and the neonatal intensive care unit, and that really has blossomed over the years to include cardiac surgery, genetic counseling, our prenatal diagnostic center, a number of rotations for medical students, outpatient clinics such as structural heart clinic and electrophysiology, and the list goes on. In 2016, though, specific to cancer, we did expand our affiliation to include hematology oncology services through the employment of 2 physicians and the opening of the UCSF Washington Cancer Center in January of 2017. So as you see on this graphic, the affiliation has been growing over time. Now the physicians, as of 2018, do also provide the physician services in our Washington Radiation Oncology Center. We work closely with UCSF in identifying the equipment in the Varian Trubing Linear Accelerator, which is now operational in the Radiation Oncology Center. And now we're at this phase where we're looking at what is the future of cancer care here in the district. Really, the vision is to combine the benefits of an academic tertiary medical center with the benefits of a strong community district hospital in Washington Hospital. So UCSF obviously brings to the table an internationally recognized clinical research program. It's nationally designated comprehensive cancer center. It has world-class subspecialists and cutting-edge diagnostics and treatment modalities. And they have demonstrated a commitment to effectively partnering with referring community physicians in the care of their patients. And I just mentioned all of the benefits and the history of Washington Hospital and our commitment to providing those resources here to the district residents. So combined, really the vision is to provide excellence in oncology care, outstanding patient-centered care, really for Fremont and Southern Alameda County, focusing on the district residents with a very high level of patient satisfaction. As we've mentioned before, back in February and March, this is a multi-phase proposed approach. We currently have on the left-hand side 3 different main key components outside of our inpatient care in the ambulatory setting, and that really is the Radiation Oncology Center, the Infusion Center, and then of course the Hematology Oncology Clinic. Phase 1 is focusing on radiation oncology initially, but the vision is to ultimately have all components of the service line combined into one joint venture, really so that we can provide the best care across that continuum. So this first phase, as I mentioned, is focusing on radiation oncology. And the idea really is about that proved access to tertiary care when patients need it, decreasing those hardships, expanding clinical trials to our Radiation Oncology Center and leveraging that relationship with UCSF, leveraging the expertise that they have throughout their cancer program and their other subspecialties, and making those subspecialties available locally as much as possible through expanded program development. So as you recall, in February of March, we first brought through the first phase of agreements for the initial joint venture documents, the letter of intent, operating agreement, and the contribution agreement, and the board approved those in February and March of this year. Since then, we've been working closely with UCSF to negotiate the remaining joint venture agreements, and those are outlined in the resolution you have before you today. So these include the management services and subservices agreement. These are really the mechanisms through which the hospital will operate radiation oncology as a hospital outpatient department. We have a trademark and licensing agreement between the 2 organizations. And then there's the professional services and clinical care management and medical direction services. And those are really the provision of the medical direction and the physician services for the department. And then a UCSF agreement really focused around quality, communication, access, research, and education, or the Q-Care agreement. We've also since then completed our hospital outpatient department application and received preliminary approval from the California Department of Public Health. And we've been going through a number of operational and administrative tasks in preparation for the joint venture commencement. So really if approved today and pending that board approval and the final determination of a go live date, between the end of November and January, we will complete those joint venture due diligence requirements. We will complete our on-site survey with the California Department of Public Health for that hospital outpatient designation, and ultimately it will culminate in the transition of the radiation oncology service to the joint venture and then operating under the joint venture going forward. So what you have before you today is the Board of Directors resolution number 1246, seeking approval to give our CEO authority to execute those agreements and additional authority to complete phase 1 of the joint venture. And with that, we can certainly answer any questions you may have.
Thank you, Donald. I know it looks very simple in those slides, but it's taken months and months and a lot of hard work, and we appreciate all that you and your team have done to get us to this point.
Yeah, the team's put in a lot of great work. Thank you.
Yeah, thank you. Any questions, comments from the board members? No. Very good. Then we have a motion to approve resolution number 1246, please.
Yes, Madam President. I move that the board approve resolution number 1246.
Thank you. Is there a second?
Second.
Thank you, Dr. Nicholson. Roll call, please.
Director Yee,
Aye.
Director Stewart,
Aye.
Director Wallace,
Aye.
Director Eapen,
Aye.
Director Nicholson.
Aye.
Very good. Thank you. Thank you very much. Great. Thank you, Donald.
Thank you very much.
All right. Any announcements this evening, Kimberly?
I have no announcements.
Okay. Well, then we will now go into closed session. However, before doing so, I want to let the public know that they have a right to know what reportable action, if any, was taken by the board during the closed session. Normally, the board would make that announcement following the closed session. As we do not know how long the closed session will last, we do not want members of the public waiting indefinitely on the phone for the board's report. Therefore, we ask that you contact the district clerk tomorrow, and she'll be happy to respond to any inquiries about reportable board actions. Our minutes will continue to reflect any reportable actions taken. Thank you. The board will now adjourn to closed session.